become a dentist. Out of 3 lakhs,
out of
only
3 lakhs, yes.
2,000 students.
Exactly.
My God.
You have to be in the top 5% of the
Right.
candidates to get into the government institute.
There are a lot of controversies surrounding medical colleges when it
Mhm.
comes to donations and
Yeah.
quotas
Yeah.
and whatnot. Does that make far more difficult for students?
Yeah.
Again, one more
Yeah,
uphill.
that is there.
Going to dentist, I think kids also used to fear going to dentist as
Yeah.
earlier. But I
Yes,
think
yes.
now with
It
all
is
of
getting
this,
better.
yeah,
Yes.
I think that in itself is evolving so much.
Mainly, if you want to look out for these symptoms, mainly focus on your lower front, 4 to 6 teeth. When we brush in a horizontal way, it does not clean the teeth
Clean it.
completely because the food particles that get stuck in between the teeth.
Should I use an electric toothbrush or a manual toothbrush? Why do I have to brush my teeth every day when my dog does it? Hi everyone, I am Nikita Daniel and welcome to What's the Point Season 2. And today I'm in conversation with Dr. Abhirav Karve. He's a dental surgeon. Actually, he's that one dental surgeon out of the 10 who does not recommend your regular toothpaste. Just kidding. But seriously, we have heard क्या आपकी टूथपेस्ट पे नमक है a lot of times. But now let's hear it from an actual dental surgeon and a one that celebrities trust too. So, hi Abhirav. It is such a pleasure to have you on our show today. How are you feeling today?
I'm
on our
feeling
show?
great. Hello, Nikita, first
Yeah.
of all. I'm so glad to be here on your show.
Thank you so much, Abhirav. Thank you so much. So, I would like to ask you, how did you pick dentistry as a career? Like, first of all, actually, is it actually different than a regular dentist? Being a dental surgeon, like, what is the difference?
So basically, a dental surgeon and a dentist is one and the same thing. BDS, that is Bachelor of Dental Surgery, is the degree that we obtain after our graduation.
Right.
A normal dental surgeon can perform all the surgeries on his own, of course, after some experience.
Yeah. Right. And how many years have you been working
I have
for
been
now?
practicing for 7 years now. I passed
Oh,
out in 2018.
That's a long
Yes,
time.
yes.
And how did you pick dentistry as a career? Like, what drove you towards it?
Yeah. So, starting from my school days, I was pretty clear and pretty sure I was interested mainly in two subjects that were math and science. So, obviously, following these two subjects, the obvious choices were engineering and medical.
Right.
Later on, after I passed my 10th, and you can say mid of 11th standard, I realized that I was not really inclined towards engineering.
Right.
So, I decided to go for medical. Now, in medical also, since I have a family history of dental, I decided to go for dentistry and I zeroed down on the dental field.
Oh, so you have
Yeah.
a whole family. Your family
Yes,
is all into dental.
Yes, my father is practicing for 37 years now.
Wow.
So that is the history.
That's a family of big happy smiles, I'm
Yes,
sure.
yes.
And what was preparing for dental college like? What was the experience studying dentistry
So,
like?
first of all, after I had decided that I had to go for dentistry, deciding on doing it and actually executing it or actually achieving it is a completely different ballgame. So, after I decided for it, I realized the number one college in Maharashtra for dentistry, for dental college, is Government Dental College and Hospital Mumbai.
Right.
So, the interesting part starts here. To give you the perspective of how important a government institution or a college is for medical and dental field, to put it into numbers, about the medical entrance exam, about 3 lakh students give it every year, and you can say top 1500 to 2000 students get into the government institutions.
Right.
This
Out
gives
of 3
us
lakhs,
out of
only
3 lakhs, yes,
2,000 students.
exactly.
My God.
That gives us roughly a
Yes.
staggering figure of 0.5%.
Right.
So you have to be in the top 5% of the
Right.
candidates to get into the government
My
institutions.
God. That's
So
one.
looking at the uphill task at hand, I put in a lot of genuine efforts,
Right.
and of course, with some luck on my
Yes.
side, I was able to secure my admission into government dental college.
Correct. Okay.
That was a
so-
great achievement at that.
And like, were you just aiming for in Maharashtra itself, or are there like any colleges outside you were also
Maharashtra
looking to
was
pursue?
preferred because the college that I'm talking about, that is Government Dental College, we call it as GDC in short.
Right,
That is the number one college in Maharashtra and of course India wide also,
right,
because there are a number of reasons. First of all, it is a government institution.
correct,
The exposure of patients is huge. Apart from that, it has got a long history,
right.
and the location of it is very convenient for all the patients to travel to. It is
Correct.
exactly besides CST station,
Oh,
previously
that's
called as VT
very
station.
convenient, sure.
So the exposure flow and all those things important for a medical field are maximum with this college.
Right,
That was the
right.
biggest advantage.
And I think I would also like to ask you that there are a lot of controversies surrounding medical colleges when it
Mhm.
comes to donations
Yeah,
and
yeah.
quotas
Yeah.
and whatnot. So do you think that also really makes the whole getting into colleges process, apart from it already
Yeah.
being so tough studying with all this 0.5 percentage, and then again there would be donation quotas or some
Yeah.
other quotas. Does that make far more difficult for students?
Yeah.
Again, one more
Yeah,
uphill.
that is there. Unfortunately, fortunately, that is the scenario. It is a really sensitive topic.
Right.
So reservations are required for people who don't have the same upbringing as
Right.
most others might be having. But sometimes there is misuse of this reservations.
Right.
That is the thing we should take care of. But all these things are part and parcel of the game. We have to
Yeah.
live through it and go by it.
Right.
Donations are also there, but donations are not there in government institutions. That is why they are
Correct.
the premier institutions in
Oh,
India.
so like
They
donations
are
are
there in
something which
private
more happen
colleges.
in private
Yes,
colleges,
yes,
right?
yes,
That's
yes.
why people prefer government colleges.
Yes,
And I had
exactly.
recently also read about the NEET examination
Yeah.
that happened, and
Yeah.
students were like coming out and crying that it was the most difficult
Yeah.
examination of all times.
Yeah.
So I can understand
That
how
is the
much.
medical entrance exam.
Yeah.
But even if the paper is difficult or easy,
Right.
it depends on the percentile score.
Okay.
So even if the paper is difficult, say the marks will drop down, but it will drop down for everybody.
Right.
Then you have
Right.
to be in the, as I said,
So
top
then
5%
again
of
the
the
cutout
candidates.
will again come
Yeah,
according to that. That makes
That way.
sense, really. Yes. And so we have a lot of misconceptions when it comes to dental, studies
Mhm.
and doctors who are dentists. People constantly keep, I think, joking about it कि तुम real doctors भी नहीं हो and everything. So what are these? How do these things? What is this misconception? Like biggest misconception about
Mhm.
dentists or dental surgeons
Yeah.
that you would like to really clear off?
There are a few misconceptions. I'll tell you about them.
Yeah.
Before I start with them, I'll just like to continue about the dental college aspect,
Yes.
from which we'll get the basic idea for
Correct.
this. So my actual career path or journey started from my third year of dental college onwards.
Right.
So what happens in our third year is, until the third year we do preclinical work. That is, we work on phantom heads
Okay.
and models and all those things, and we learn our
Right.
treatments and skill. From third year onwards, we start working on actual patients. We
Right.
start treating them, of course, under the guidance of our professors. A few months into our third year of college, I realized I could help all the patients in whatever small problems they had. I could relieve them of their pain. I could bring
Right.
back smile to their faces.
Right.
They used to thank me, give me positive feedbacks. And I had a major realization at this point of time. I realized I could gain their blessings and well wishes, their
Yeah.
good vibrations.
I think that's really
Yeah.
a fulfilling
Yes,
thing about
very
being
fulfilling,
a
a
doctor.
very satisfying thing.
Yeah.
At that time, I realized why medical or dental is called as a noble profession.
Correct.
And at that time, and from that phase onwards, I decided to pour my heart into this profession and career.
Right.
That is how it started from there.
that-
Now, coming to the misconception part, you can say for our course as well, we have got all the medical subjects that are there for
Correct.
MBBS as
For
well.
any- yes.
Only for the last year, all the dental subjects come up,
Correct.
leaving the medical
So it's
subjects
like
aside.
any other course, even in
Yes.
engineering, I think
Yes,
it's
yes,
for the
yes.
first 3 years, everyone studies the same
Yes,
courses,
yes,
and
yes.
last year
It
is your final.
Similar, yes, it is pretty
Yeah.
much similar.
Guys, it's a misconception. Stop calling them not doctors. They're studying the same
And the
thing.
internship is different, of course,
Exactly.
because
Right.
we are treating different things. and
Yeah. Plus, your
MBBS
teeth are very
applied.
important, guys. The most important. That's
That
the
is there.
first thing everyone is going to see.
Now, the other misconceptions come into practice are, you can say, the first one is that dental treatment is expensive.
Right.
Now, if you consider the charges of dental treatments in India and comparing it to abroad and other countries,
Yeah.
mainly the Western countries, you will realize the funny thing is the dental materials that we use, the technologies that we use are exactly the same.
Same.
What is used in New York is exactly
Yeah.
similarly used in Mumbai with
Yeah.
us, but the difference is in charges is huge.
Oh,
It is in India, it is less than 1/10 of what they charge in
they
UK
charge in
and
UK.
US. Yes,
Right.
and the skill of Indian doctors is already well known in the
Of
entire
course,
world.
of course.
So that is a major misconception that it is expensive in India.
Expensive. in
Rather, it is not expensive in India.
It is
that way.
actually more expensive outside,
Yeah.
even though we are using the same technology.
Yes,
usually.
yes, with the
And
same
I think
technology,
dentistry
same
is also a
material.
profession which actually uses a lot of technologies, right? Like
Yes,
you're
yes,
creating
yes.
teeth out of, a single tooth, out of your screwing teeth and whatnot, and still
Yeah.
making it look so real. With like it's, I think my dad had this one surgery where he had all of his teeth removed and had.
Yeah.
I thought it was going to be a dent, like those dentures or
Yes,
something.
yes, yes.
But that was not the case. It was
Mhm.
just, how
It must
caps
be
are, but like
implants,
all
yeah.
all caps, but they
Yeah.
were not screwed also. And I was
Mhm.
like, what? I
They
couldn't
must be in the
understand.
form
But
of
when he
a
came back
bridge,
from the
yeah.
dentist, I was like, these are your teeth. These
It's
are
a great
just
thing,
your
right?
teeth. Yeah.
So fortunately, we have got a lot of technology,
Right.
lot of developing dental materials,
Correct.
and to use them properly according to the given situation. So
Mhm.
in our field, it is actually a big enjoyment for us because we have to think at that particular
Correct.
situation. We have to be in the present.
Very
So the
quick.
same formula is not going to work for everyone.
Everyone,
It is
right?
going to
Because
be a different
everyone is going
situation
to have.
each and every time. It is going to
Correct.
be a different treatment plan or solution that is required for that particular
Right.
person or individual.
Makes sense. Everyone is going to have different teeth,
Yes,
different
yes.
problems.
Yes, yes.
Very.
There's one more very important
Yes.
misconception, which is related to pain. Many
Oh.
people are scared that dental treatment is very
Yes.
painful. But I'd like to tell you, nowadays, dental treatment is almost, I cannot use the word painless because
Correct.
it will be an over promise from
Right.
my side, but it has become very minimal now.
Right.
Say, for
It's not very
example,
invasive also
yeah,
these days. Even when
yeah,
it comes
has
to
become
braces,
simple.
earlier they used to be so, and now they have invisible braces.
Exactly,
and
exactly. That is
everything.
how the technology helps us
Right.
everywhere.
So it's an ever evolving
yes,
profession.
yes,
Like
yes,
you're
yes. We have to
constantly coming up with
keep up to
something
date
new.
with what is
Right.
happening and how we can use that technology to our
Correct.
best use, to the patient's best use.
Right.
All those things we have to keep on thinking.
That's
I'll give you a very simple
Yes.
example on this. There is a very special technology that has come up. The biggest fear nowadays in patients in any dental office or dental practice is injections, that is syringe and a needle. That is the most fearsome
Yeah.
thing. Now, to avoid that, there is a special technology called as the wand.
Okay, the wand.
Similar to the word, it is really magical.
Okay, a
The
wand.
yeah,
like
yeah,
how?
exactly. So the medical term for it is CCLAD,
Okay.
which means computer controlled local anesthesia delivery system.
Okay.
So what that does is it eradicates the normal use of a syringe and needle entirely,
Ah.
and it has got a very special handpiece which you have to just hold between the tooth and your gums. So just hold it there for about 3 to 4 minutes.
Yeah.
And of course, it is technique sensitive.
Yes.
It is very
But
easy
at
to
least
say.
it's not going to be
Yeah.
poking into your
Yeah, we are not going to be pricking exactly.
Yeah.
You hold it in between the tooth and the gums,
Mhm.
and for 4 minutes,
Oh.
it anesthetizes the entire tooth properly.
Oh, wow.
So pricking
my,
of the
my
needle
dad would have
and everything
actually
is
loved this.
yes,
He's
yes.
taking. Yeah.
So all these things have come up, and now the pain levels and all those things can be controlled pretty much, and
Yeah.
it should be very close to being painless now.
Wow, that's actually
Yes.
very interesting for all the people who are about to get dental treatments or scared to do so. Guys, it's very painless these days. And other than that, I think my other question for you is now dentistry has not just been about fixing cavities or just
Mhm.
whitening your teeth. It is
Mhm.
also a sense of beautification has been added to it. People
Mhm.
who everyone is so much in front of the camera these days.
Yeah.
The professions are content creators and everything. So
Lifestyle
everything
is
is very
changing now.
zoomed and everything.
Yes,
So
yes.
everyone wants perfect, beautiful looking teeth. So how
Yes,
has
yes.
that changed the shift? Has there been a shift from what things the your patients also demand? Like
Mhm.
दांत शायद cavity नहीं होगी, but
हाँ.
नहीं कुछ तो कर दो अच्छा लगने के लिए. Does that ever happen?
Of course, it is a big shift that is happening slowly
Yeah.
and gradually, but surely it is there. So previously, you consider, say, 20 years back,
Right.
mainly the dental practice used to be symptom related,
Correct.
as in cavities or pain or the patient can't eat properly,
Mm.
only then they used to visit the doctor at
Right.
that time. And treatments like for all these problems, treatment like root canal treatments,
Yeah.
getting the teeth extracted, removable dentures, all
Yes.
these solutions were there.
Yes.
But nowadays, as you have mentioned, the lifestyle is changing
Correct.
and all those things are updating. The people are more aware now
Aware.
due to social media, Google, and
Yes.
all those stuff. So aesthetic treatment is also increasing.
Correct.
My perspective to this is aesthetic treatment is really important, but the only important thing is it should be non-invasive or minimally invasive.
Correct.
You should not touch or harm your natural teeth for the
Right.
purpose of aesthetics.
So
That-
have you also had any very weird requests, since you also deal with a lot of
Yeah,
celebrities?
yeah.
And yes, guys, he deals with a lot of celebrities. Can you name some for us? Someone's teeth is like really.
It won't be really good on my part to give out
True,
names, right?
true, makes
Because
sense.
after all, they are getting some treatment done.
Of
No? It is
course,
a
of
medical
course.
profession.
So can you at least tell us what if they have had some very weird requests? Because these days, I don't know, internet. If you go over the internet, people are
Mhm.
demanding crazy stuff out there. So have you had any celebs or like people who, or even general patients,
Yeah,
even
yeah.
they can want any weird treatments
Yeah, yeah.
or any weird fixations for the purpose of aesthetics only?
Mhm. So when you ask this question about some weird requirement or a
Yes.
funny incident, two incidences come to my
Yeah.
mind. One of them being of a celebrity patient.
Mhm.
So he just came to me for a regular cleanup appointment, and 2 days later he called me up and he told me I am being offered a role,
Okay.
and that role is going to start say about 2 months from now.
Yeah.
And he was slightly on the heavier side.
Yeah.
He wanted to get his weight down for that
Right.
particular role, and he was persisting me and asking me to just tie down his upper and lower jaw together with the help of wires so that he cannot
He
open
can-
it completely and he cannot have solid food.
Oh.
Because his biggest problem was he was telling me I can work out, that is not an issue.
Yeah.
But the main problem is I can't stop eating. I am a big time foodie.
That's one solution.
So he was behind me for
Yeah.
3-4 days asking me to wire
Like,
and shut up his mouth
Shut
so
his
that he
mouth
can't eat.
so he can't
Yeah,
eat.
maximum we
Oh.
can have is liquid diet
Right.
and soft
Yeah.
smashed food, maximum.
Oh
That
my.
is what he was asking for. I was really amazed where this has come up from
Right.
in his mind and all those things.
Did you? And
No.
this was not even a joke. This was
No, this has happened. This has
Right.
genuinely
And you
happened.
did it? Did
No,
you
no,
actually
of
go
course
through
not.
it?
No. You're not even allowed to do such
Of
kind
course.
of a thing.
Was it easy to convince the celeb ki we really can't do this, sir?
Yeah, so at start I thought he was just joking around with
Right.
me, and
Yeah, it
it
does
was just
sound unreal.
it was kind of that thing. But later on I realized he's very serious about it. But I had to convince him and explain it to
Yeah.
him what the situation is, why that cannot be done,
Correct.
and all those things. Then he
Yes,
understood
then-
properly. Yes.
I hope he lost his weight.
So after this incident, I was just sharing it with my family because,
Yeah.
of course, it is a very
Of
weird incident to happen and very rare thing to happen
Yeah.
as well. So as soon as I told my parents about this, they had a spontaneous reaction. They told me there was a very old movie, I think in the 1970s, of Mr. Amitabh Bachchan
Right.
called as Bombay to Goa.
Yeah.
In that movie, it revolves around a bus journey from Bombay to Goa,
Correct.
and there is a lady with his son who is traveling on that bus.
Yeah.
So during the entire movie, the son has got a scarf
Mhm.
which is tied around his mouth, and his
Yeah.
mouth is shut during the entire movie.
Yeah.
So when you are watching the movie, you are just thinking, what must be the reason? He's not
Correct.
even talking, he's not even doing anything
Right.
else. There's just a scarf tied to
Right.
his mouth. And at the last scene of the movie, the mom takes out his scarf,
Mhm.
and the first thing that the kid says is, Mummy Pakoda.
Mummy pakoda.
So he's a big time foodie, and of course he was slightly on the heavier
Yes.
side. So his mom wanted him
Him
to
to
eat less.
Control the eating.
Yeah, and that's why she had put the scarf on.
Oh, so I think that's why he got
That
an
must
idea
that
from.
might be the inspiration, or some
Yeah.
other movie you might have watched at that
True,
time.
true.
Must be an inspiration.
Yeah,
For him.
very, very fun. Wow.
Yeah.
Any other weird or funny requests people have
Yeah.
made?
So when you asked me that question, one more incident came to
Yeah.
my mind. At that time, it was very serious, but
Right.
now we can take it in a funny
Yeah.
way. So what happened is, a patient of mine, she was 12 years old.
Mhm.
So what happened is she had some accident while she was
Right.
playing with her friends. It is
Mm.
very normal at that age.
Yes.
She was playing in the garden. So they got her to the clinic in evening time. And unfortunately, she had lost her front two teeth, the
Oh.
main two incisors.
I relate to
Yeah.
this so hard.
Yeah.
I had fell down and I had broke half of my front tooth.
That was
This is
half,
fake,
right?
guys.
That was half, right? She
Yeah.
completely lost
Oh
them.
my god.
They came out completely. And at that age,
Yeah.
those two teeth,
The
especially for a
permanent
girl,
teeth,
yeah. For a boy, at least you can still understand.
Yeah.
For a girl, it is way too important.
Correct.
And she had injury marks on her lips and
Oh.
all those things. So they came down immediately in a
Hmm.
urgency kind of a
Yeah.
situation. Once they walked in, we inspected everything. I checked her lips and everything. And then I asked him, Ki, where are the teeth that have
Yeah.
come out? And then they were like, we have no clue. She was playing in the garden. It must be over there.
Yeah.
So I had to tell them, you have to go and get them now. So they went back in the
Yeah.
evening. At night, they searched the
Searched
garden.
for
They
them.
found both those teeth.
Oh, they found.
They got them back to the clinic.
That's so lucky they
Of
found.
course, of course, they were not
Yeah.
clean enough. So we
Yeah.
had to do all the sterilization protocols. Then we had to do a root canal treatment for those two
Mhm.
teeth outside.
Oh.
After all those things were done, so that they are now ready to be replaced inside.
Okay.
Normally, if they have fallen to the garden and all those
Right.
things have already happened, they are not preserved in a proper medium. Normally, it does not work. Putting it back might not work
Oh.
for us. There was literally only a 1% chance that the teeth could have gotten accepted again.
Right.
So what we did is we did the root canal treatment. Of course, the girl also cooperated very
Right.
well. And then, of course, with anesthesia, we replaced those two teeth in the same socket.
Oh.
And
So
then,
that's possible?
Yeah,
Like, I
yeah,
thought
yeah.
once it's gone, it's gone.
It can be done. It can be done. But in this situation, the possibility
Yeah.
of it turning out a success was very less.
Right.
But I
That
explained to
sounds
the
tricky.
patient, instead of doing anything else, instead of losing their tooth permanently, even if there is a slight chance, we should go for it.
Right.
And then we went for it. We had to immobilize the teeth as well for the next 4 or
Oh.
5 months. But fortunately, till date, about 3 years from the
Yeah.
incident, the teeth have been accepted and everything has gone smoothly.
Oh, that's so
So it
sweet.
was
The
a
girl must be
big
so
thing, yeah.
happy. Yeah, that must be actually so
Yeah.
happy for it.
Her
12 year
mom
old
majorly.
losing it and then having it back. It must be
Yeah.
very
I
fulfilling.
think
for
she'll
her as
realize
well.
the importance when she turns
When
18 or 20.
yeah, true. I think she must do it right
Yeah.
now also because I cannot thank my doctor enough for this tooth.
It is there.
That's very interesting. And since like this was what you're saying 3-4 years
3
back,
years back.
and
yes,
even
yes.
then you could do this,
Yeah,
right?
yeah.
And with advancements which are right now and
Mhm.
ever evolving profession that you're talking about, where do you see dentistry heading towards now, like say in the next 5-10 years,
Mhm.
with all the aesthetic parts also
Mhm.
coming in? Are
Mhm.
do people also, apart from just making slight tweaks in
Mhm.
their appearances,
Mhm.
there are also jaw replacements and shifting jaws and
Yeah,
everything.
yeah,
Does
yeah.
that also come under
Yes, it comes
dentistry?
under dentistry itself. Yeah.
And how does that work? Like, is it safe? Is it
Yeah, so there are many aspects. So as you
Right.
were saying, the dental field overall is evolving a lot
Correct.
under technology and all those things. So nowadays in dental and medical field, the participation of AI is increasing. To
right?
start off with, mainly with radiology, that is X-rays,
Okay.
interpretation of X-rays, interpretation
Oh.
of difficult X-rays, and all those things. Of course, it has to be correlated by the doctor after
Of
all, but it gives a basic guideline first
Okay.
of all. Apart from that, there are many other dental technologies which have evolved in the past few years.
Yeah.
To name a few, there are 3D printers, there are
Oh.
lasers, there is CAD/CAM technology.
Right.
Now, what CAD/CAM technology is, whenever we make dental crowns or dental caps and bridges, previously we had to take rubber-based impressions. A
Right.
clay-like
yeah.
mold used to be pressed into the
Yes.
jaws.
Used to
And
taste
then,
like bubblegum.
yes, exactly. It had different flavors, bubblegum,
Yes.
pineapple, and all those things. So we used to take out the rubber molds and pour plaster into them. And a
Right.
plaster model of your teeth was made.
Correct.
On those plaster models, lab technicians used to make caps by hand, and then we used to fix them,
Oh.
or bridges by hand, and
Right.
all the prosthetic work basically.
Right.
Nowadays, instead of a physical rubber impression, we take a 3D scan.
Oh.
Now, a 3D scan is a very simple, almost like clicking a video of your teeth, and the entire exact size and shape of your teeth, gums is recorded in the form of a 3D model in our software.
Oh.
Now we design the crowns, bridges, any prosthetic appliance in the softwares, which is called as the CAD,
Yeah.
and then it is milled. By milling, I mean it is exactly cut in the shape we want by a robotic arm.
Oh.
So the cap is ready completely through a digital workflow.
Digital. So
No
like
human
no
touch is
manual,
involved.
anything.
Yes, exactly.
And do you have to like study something else? Does
Mhm.
it come with an added on course or
Yeah.
like more studying. I understand
Yeah,
obviously everything comes with more studying, needs more practice and
Yeah,
everything.
yeah.
But is it different than whatever you study in colleges, or is this also incorporated in colleges these days? Like when you are pursuing your
Mhm.
BDS
Mhm.
or I think
Yes,
BDS.
yes, BDSS. So what happens generally, most of the things are there in the college curriculum
Right.
because after all, it is a
It
human
is
that we are
correct.
treating. But what happens is why it is called as a practice,
Right.
because day by day, you keep improving
Of
always.
course.
Even if your experience is 50 years, still
Right.
every day you will keep improving because every time you will encounter some new situation.
Right.
Similar but slightly tweaked situation. So you
Correct.
keep on improving slowly, day by day. That is why only this is called as a practice.
Correct.
So now during the practice years, once say I'm doing a particular treatment for
Hmm.
a few days, then I myself can think about it, what can be done better,
Right.
what else can be done to ensure the patient is
Correct.
comfortable, ensure it is painless,
Yeah.
and all those things can be worked upon.
Oh.
And the newer technologies that are coming up,
Hmm.
for that, of course, you have to keep up to date,
Up
you have
to
to attend all the
Oh, there are
conferences.
conferences.
Every 2 years, there is a major conference which happens in
Mhm.
Germany.
Right.
If we
Oh.
can visit that, so we get a lot of exposure, and
Right.
then small courses associated with the new technologies are always helpful.
Helpful,
It's
right?
that way, yes.
So if people have to pursue this, they
Yes,
also have to constantly keep on their
yes,
toes कि
yes,
सिर्फ
yes,
पढ़ाई करनी
exactly.
खत्म नहीं हुई guys. It's
Exactly. But
constant.
padhai might be boring, but the second aspect that we are talking about right
Mhm.
now, it is really interesting because we
Right.
are finding newer solutions
Yeah,
to
that
help
must be
people out.
far more interesting though. Like
Yes,
you're
yes.
actually
So we enjoy
hands-on
that aspect.
working. You are coming up with new things. It's
Ha,
creative.
it is
It's
not just
basically
theory.
creative.
Yeah, exactly,
It's a
exactly.
creative profession, guys, along with science.
Yes,
This is
yes,
what they mean, I think, when they say science, art is science. This is what it
exactly.
is. So one more thing, I think I'll like to circle back to my question,
Yeah.
like about how people are really still for the beautification of it, just
Mhm,
smile treatments,
mhm,
whatever people come from
mhm.
for, and are those safe? Are those something people should actually go for? Is it just aesthetics wise okay?
Mhm,
Aesthetic के लिए चाहिए तो कर लो, but
mhm.
does it have any health?
Yeah.
I don't know, benefits as such.
Mhm. So basically, now as we were talking earlier, aesthetic dentistry, the awareness for aesthetic dentistry
Right.
is increasing slowly.
Correct.
So there are many or most procedures which are non-invasive or minimally invasive, which can be safely
Yeah.
gone for. Like we were talking about aligners.
Right.
So basically, there are numerous problems for smile
Correct.
correction, like gaps in teeth or
Right.
the front teeth being protruded,
Right.
or you can say dark yellow colored teeth or
Mhm.
a gummy smile.
Right.
Now, to correct all these things, the most simplest and the non-invasive way is by braces or aligners.
Right.
So braces, simply, you must be knowing already, people also must be knowing, they are brackets and wires that are bound to our teeth, and along with them we change the position of your teeth, we carry out movement. Now this is a very special science because our teeth are embedded inside the jawbone.
Right.
So to move that tooth from position A to position B is not very simple because we
Correct.
have to move the bone inside as well. You have to resorb the bone for the tooth to go over there,
Yeah.
and all those things need to happen.
Correct.
So this can be done with braces,
Hmm.
as it has been done traditionally. Nowadays, with advanced technology, we have got aligners.
Right.
Aligners are basically transparent, or you can say invisible trays that you have to wear in your upper and lower jaws,
Right.
and they are sequential sets of trays. So the technology is so unique and special. We take a 3D scan of the teeth first, like I was telling you before, just
Yes.
like clicking your video of your teeth. And in our planning softwares,
Hmm.
before doing any treatment, we decide the entire treatment plan, so as to how much time it will take,
Right.
what changes we are going to get, and we also get an idea what is going to be the end result,
Yeah.
kind of a preview of what the result is
Correct.
going to be. And then we set up the trays, that is the aligners. Now the concept is such that each and every aligner has to be used for about 2 weeks, 15 days.
Right.
So once the patient wears the tray number 1 or aligner number 1, it is slightly tight at first.
Correct. Yeah.
Once the movement that is supposed to happen because of that aligner occurs, it becomes slightly loose, it becomes passive.
Right.
Then at the end of 2 weeks, we have to use tray number 2.
Oh, so it
Sequentially,
keeps.
3, 4, 5,
Right.
that is the set of trays that we give out to the patient.
Right.
Now the technology is so special. Say the patient is on tray number 10 and he's going to tray number 11. So at that time, what the position of the teeth is going to be there?
Yeah.
that is predicted by the software and the doctor before we start the treatment.
Oh,
So
before the
yeah,
treatment
so say
happens
the
already.
treatment is going to last for an year because
Yeah.
it takes time for all these movements. So the entire setup of trace for the entire year is given up for the
Okay, so
patient, to
it's
the
not
patient.
something you make every 2
No,
weeks.
no, no,
It's
no. We can
something
give it
you
upfront.
you give the
Yes,
whole
yes.
set. That's
So
that's
that gives a
very
lot of convenience. The patient does not have to visit the
constantly
doctor
visit the
immediately. He
doctor.
can visit after 4-5 months just for a routine checkup to
Checkup.
just check कि सब कुछ ठीक चल
Yes.
रहा है ना,
And
कुछ जरूरत
has
नहीं है.
it always like stood true to the predictions? Like has it ever
Yes,
happened
yes.
कि oh, someone's it's not 2 weeks
Yes, yes,
बाद same ही लग रहा
that
है.
is there because this technology is still new. The
Correct.
AI of this technology is developing slowly.
Right, it's very recent.
Right now, yes, right now, currently, you can say this aligner treatment is possible in 70% of the situations.
Oh,
30% of the situations where the movement is severe
right.
and all those movements, in those situations, aligners is still not possible.
Possible. Oh,
So
okay. But I think
once
it's
we
still a
assess
good
the
number,
situation, once we
70%
assess the
is
case, we let the patient know upfront.
correct.
If it is 100% possible, only then we go ahead with the aligners.
Right.
Otherwise, we ask them to go for traditional braces.
Traditional braces. So we can say aligners is mostly just a beautification process, and because
Yeah.
for some people putting braces has always has been a very severe issue also. Some people have some health
Mhm.
also because
Mhm.
they have crooked teeth or something.
Yeah,
Then that's
yeah.
that's something aligners will not work
no,
at, I feel.
aligners do that
They do
also.
that
Yes,
as well.
yes, yes,
Wow, I
yes.
did not
Only
know that.
severe situations, say if a tooth is embedded inside the jawbone, it has not come out at all.
Right,
Mainly the canine, which is an important tooth for
Right.
us. If that has to be got down,
right.
if the wisdom molar has to be got up, in
Yeah.
all those situations, we have to avoid aligners. It is
Oh,
that way. And aligners and braces, both these treatments, as we were talking, is completely non-invasive.
right.
So it can 100% we can be going for that. Aesthetically, of course, it helps the patients to look good. It gives their smile back.
Correct.
But more importantly, functional bite is also corrected in the same treatment,
Correct.
which is really important. Maybe the patient might not realize,
Realize.
but it is very important for the doctor because most probably this treatment is done at the age of around say 14, 15.
Correct.
After that treatment, bite correction, functional correction is done. For the entire life, the problems that the
Oh.
patient or the kid will suffer will be much less.
Less, right.
And he'll be more comfortable with his teeth and
Correct.
jaw size.
And have you had then, since I think yeah, even I had my braces when I was
Yeah.
like 14 or something.
Yeah, yeah.
And it's really doctors also push कि आप जितना young हो kids
हाँ,
उतना young
exactly.
में if it's happening.
Exactly,
But
exactly.
what happens when people who are like grown ups,
Hmm,
people
hmm,
who are
hmm.
20 plus, 18 plus
Yeah, yeah.
plus, does it become more difficult for the whole procedure? Does it take a lot of time
Yeah.
than it would earlier?
So ideally, the perfect age is, as we were saying, 14, 15 or
Yeah.
12 to 15 of age to start the treatment because the treating doctor gets the growing age of that kid.
Correct.
So accordingly, the movement is quicker
Right.
and the results that are achieved are stabilized with the growth of the patient.
Right.
Once the growth stops, the teeth position also stabilized.
So does it
But
become
in-
more complex when you're doing it on
Yes,
a
slightly. But fortunately, previously, say about 15 years back, in adult patients past the age of 40 or 50, it was not possible at all.
right?
But nowadays, with advanced technology of braces, brackets,
Oh.
aligners, all those things, we can do braces in much elder age groups as well.
Oh, that's
50, 55,
Yeah.
even 60, 65 also.
Oh,
we
and
can
have you
do
had
treatment.
any patients who
Yeah,
had
we have,
braces
yeah, we
or
have done. But
these
normally, adult patients prefer to go for aligners
aligners?
because
right.
it is socially much
Soci-
better. It is not
correct.
visible, and all those things are there.
Right, that's very interesting.
Other very, you can say, very less invasive procedure for
Mhm.
beautification purpose
Correct.
only is called as veneer. So many patients these days come to us directly to get their veneers done because the awareness
Oh.
has increased. They see their friends doing it.
Right,
So if there are smaller issues like small gaps
correct.
or darkening of your teeth,
Yeah,
so they can get veneers done. What a veneer is, very simply, it is kind of a half crown, or you can say it is as thin as our nail,
oh.
and it is stuck only on the front surface of a teeth.
Oh.
So upper 6 teeth or
Yeah.
upper and lower 6 teeth each. We place veneers according to the shape that the patient
Yeah.
desires, according to the shade that the patient desires.
Oh.
And this procedure also completely non-invasive or
And this
minimal
is also
invasive.
like a temporary procedure.
No,
like
this is
you,
a
do you
fixed.
take
This is a
it
fixed
off?
procedure.
Oh,
Yeah,
it's a fixed procedure.
it will be cemented onto
Oh.
the teeth.
Oh,
So it will
that's
remain for years together.
So it just stays
Yes,
for
it
years to
stays.
come.
Yes,
It does
yes.
not damage or anything.
The veneer as such won't be damaged, but after a few years, the gums might recede with age. So that also
Yes.
depends on the hygiene that the patient is
Right.
maintaining and all those things. So after a certain years, after a certain life cycle,
Mhm.
you might have to replace them once.
Correct.
All those factors are.
Okay, that's very interesting.
Yeah.
This I did not know about. Absolutely
Yeah.
did not know about. And it's so, I think it's so natural looking that you really don't understand, because so
Yeah.
many times people are surprised when I tell them, yeah, that's not a real tooth or
Hmm.
something. And I'm like, yeah, right, guys.
So actually, smile is, you can say, smile is a very important emotion that we have in human
Correct.
beings. That is
Yes.
not there in other animals.
Right.
So
True.
fortunately, we are in that profession
True.
catering to this exact emotion.
That's so beautiful.
So we enjoy working. We
Correct.
can get the smile back, and there are many incidents wherein it has helped the patients a lot. It improves
True,
their
it
self confidence.
confidence, right?
Yeah, it is one of the keys to their success.
Correct.
There
Not
are many
just
things.
correct,
Yeah.
not just for aesthetics
Yes,
purposes,
yes.
but I think it's so important for a person's own confidence,
Exactly,
self-love, call it whatever.
Exactly.
But I think it's very important when people feel confident when they look at themselves
Yeah,
and you smile
yeah.
at yourself. If you look at yourself in the mirror and you just feel confident. I think that's a
Whenever
very
there's a smiling
important.
personality, it is
You
always
instantly
perceived as a good
exactly, you
person.
instantly
The
perceive
vibrations are
positivity.
better. Exactly.
Yeah,
exactly.
it's always nice to
So
have.
all those factors and vibrations resonate very well with our smile.
That's
Is that
yeah,
way.
that's very nice. That's such a good thing to be associated
Yeah,
with. I think I'll remember this. And I think you mentioned wisdom tooth, and all I could think of was pain, a lot of pain. And I would like to ask, is there any certain procedure which which would like really, it's a painful procedure,
Mhm.
like wisdom tooth. I mean, that is all I could relate of wisdom tooth to. Oh, it's going to be very painful.
Yeah.
So, speaking about wisdom teeth,
Mhm.
I would like to ask if there are any other very painful procedures when it
Mhm.
comes to any tooth related procedures.
So I got your question. I got your point. As I was telling you before, fortunately nowadays the pain has almost gone down to zero
Right.
because of all the advanced technology, that the care that the doctors
Correct.
are taking, the expertise, experience, all those things. And as such, in any dental treatment, a lot of pain is not expected.
Right.
Since you're talking about wisdom molar extraction,
Yeah.
mainly what happens in lower wisdom molars, many a times nowadays they're stuck inside the jawbone in a
Right.
horizontal manner, and they
Yeah.
put pressure on the tooth before it.
Correct.
There is food lodgement between the wisdom molar
Yeah.
and the tooth before it, which causes cavities and pain. So, and in these situations, we have to go for surgical wisdom molar removal or
Right.
extraction. Now, this procedure is of course done under local anesthesia. Your jaw will be numb. So,
Right.
during the procedure, as such, pain is not expected.
Mhm.
Slight pressure, slight vibrations will be felt. And after the procedure, in this procedure, slight swelling is expected for the first 3-4
Right.
days. And you
Okay.
can say slight discomfort, slight underlying pain for the next 7 to 10 days.
So it's
So,
basically like
yeah.
any other operation if
Exactly,
you're going
exactly. Because the body has to heal. Na? In
Correct.
very simple language, our body has an injury over there.
Right.
Because we have removed the tooth surgically.
Of course.
To cater to the injury, body sends all its army to in that position. But that is why there is a swelling over there.
Correct.
That is why it has to given some. It has to be given some time, about 3-4 days, for the body to settle down on its own, and it heals better in this way. Now, this treatment of wisdom molar removal, you can say, the post effects are the most. All other treatments are lesser or easier than this. This is the, you can say, most difficult in post-op care.
Because it's like a slightly more invasive, because you're extracting something out altogether.
The injury is maximum in this procedure. It is that way.
That is why the pain associated. It makes sense. It totally makes sense.
It was very much similar in dental implants as well.
Right.
I'll just take a minute to explain you dental implant. So previously for dental implants, very simply, whenever a tooth is missing, we have got our gums. Underlying it is our jawbone.
Right.
So in very simple language, what we have to do is, after the local anesthesia, we have to cut open the gums in simple language. Then we have to drill inside the jawbone for implant placement and screwing. And during the procedure or during the surgery, the doctor or the surgeon had to decide where he had to place the implant, what should be the position, what should be the height or width of the implant screw. All those things were determined during the surgery. So it should take time. The injury to the body was more, and it was similar to wisdom molar removal.
Correct.
Now with advanced technology, you won't believe, we take 2 scans before
Yeah.
we do the treatment. First is a 3D X-ray,
Yeah.
wherein which we get the exact data of the jawbone from inside, from within.
Oh.
So as to what is the density of the bone available,
Right.
what is the width of the bone available, what is the height of the bone that we have.
Mm.
And we take a 3D scan with which we get the exact position of your gums and teeth.
Oh.
We combine these 2 scans and plan beforehand what should be the exact position of the implant inside the jawbone. What should be the height, what should be the width of the implant.
Correct.
And we also register the bite, that is how the upper and lower jaws are coming together.
Correct.
So we also plan what should be the position of the tooth after we do the implant. So all these things are planned before implant placement.
And these
I
are
mean-
far less invasive, like almost
Yes,
not
yes,
invasive
yes.
all.
That is what I'm coming to. Once both these scans are ready and the planning is ready, we make a stencil. This is called as guided implant placement.
Right.
Very simply, like we used to use a stencil in our childhood, we used to
Yeah.
just keep it on the paper, draw the number or
True.
letter and pick it up.
Correct.
Simple.
Yeah.
That we will make a surgical stencil.
Oh.
So that stencil, you have to just keep it on our jaw. It fits in according to the
To the
adjacent
other
teeth
teeth,
because we
yeah.
have taken the scan.
Right.
And where we have to place an implant, we have kept a small hole.
Yeah.
Now the dimension of this particular hole are exactly in accordance to the plan that you have made.
Oh.
The height of the implant and the
Correct.
position and the angulation and all those
Yeah.
things. So after the anesthesia is done, local anesthesia of course, we keep the stencil and place the implant screw directly through that hole. Now with this we achieve many things. Mainly first is we get 100% precision and accuracy. Whatever we
Right.
have planned in the software is exactly going to get replicated.
Correct.
Because when we previously had to open up the gums and then drill into the jawbone, the bone is strong and thick.
Yeah.
So when whoever the doctor be in the world, when he is drilling inside the jawbone,
Yeah.
he cannot go in
Sounds
one
like-
position
Yes.
because there is vibrations. No?
Right.
That is why the injury to the body was more.
More.
Over here,
Right.
there is absolutely minimum injury because we are going only in one position.
Correct.
Apart from that, it hardly takes 5 to 7 minutes for implant placement, which should take 1.5 hours before.
Right.
And stitches are also not required.
Oh.
It heals up within the
Heals.
first 3-4 days. No
Correct.
swelling is expected.
That's
So with technology, we can do all these things.
true.
And this is how slowly dentistry is evolving.
That's
for
that's
us.
very interesting because anything related to your teeth, anything going to dentist, I think kids also used to fear going to dentist as
Yeah.
earlier. But I
Yes,
think
yes.
now with all of
getting
this,
better.
yeah,
Yes,
I
yes,
think
yes.
that in itself is evolving so much.
So previously, their parents were also had the emotion of fear.
Yeah,
That is
my
why the
child will have
parents
to
are
go
also
through so much.
But
Correct.
slowly, as the generations passes, the new generation will realize the pain is much lesser.
Much less.
So
right.
when their kids will be treated, they'll be
Correct.
better.
So people are
situation.
also more towards generally earlier if people had cavities also people would not go to the doctor only. He'll drill and then cement bharwana hoga and whatnot. As a child, by the way, I always thought it was the actual cement. I was like, what is that?
So of course,
Why?
they are dental cements, but
Yeah.
they are biocompatible. of
Right.
course,
And I
yeah.
was like, ये क्यों हो रहा है दांत में हमारे? But very later in life, I
Yes,
found out like that's a completely different thing. But yeah. And one thing that I can think of, like when you said why the wisdom tooth, gets stuck.
Mhm.
So I had read like long ago about some studies that our jaws are getting smaller or something. So is that
Yeah.
why this thing
Exactly,
happens
exactly.
a lot? Because these days, earlier, I don't think my parents or my grandparents, I
Yes,
had
yes.
never heard any of them complain about wisdom tooth or something. Theirs would just grow. I was like, ये क्या हमारी अक्ल कम हो रही है सच में? Are we losing our wisdom? What's up?
No. It is right what you said in the
Yeah.
first half. Slowly, as the generations pass, our
Right.
jaw size is becoming slightly smaller.
Correct.
So the human body cannot incorporate the wisdom molar as well in the jaw.
Right.
That is why it gets stuck. That is why situations where the teeth are crowded are also more.
Right.
The requirement of braces is also
Correct.
more. The jaw size is going down slowly,
Mm.
and the human race is also evolving. So as to slowly the wisdom molars are not even there for many people.
Oh.
Might be in the next few generations they'll
It will
stop
just-
coming as
Correct.
well.
It will
And
become
we'll
like,
get rid of the problem before only.
yeah, right. So is that are we supposed to consider this as a good thing or a bad thing, or is it just
No,
an evolution thing
It is
which
just
will
an
happen?
evolution. It won't
Yeah.
affect us in any way
Correct.
such because we'll be able to eat everything properly. We have got all other set of teeth intact. So it
Correct.
should not be a problem at all.
That makes sense. I
Yeah.
think evolution is a part of not just the technology, guys. It's also our own body.
And since we are not using that tooth anymore, even if it comes out, it does not come out
Right.
fully. So there is a
Right.
very basic principle that our body follows, which is called as use or lose. So
Oh,
if it is not being used, slowly over the generations, body
our
tends to lose
body
their
will
amount.
itself
Yes,
start.
yes, yes.
Correct. Makes
Exactly.
sense. And I think that was a very interesting. So, so these things, studies like these will constantly keep happening. Everything will keep evolving, and we will constantly have to keep changing as our own routines also
Yes,
when it
yes.
comes to dental care, dental
Yeah, yeah,
hygiene.
yeah.
What do you think is a very, very underrated or
Mhm.
like the basicest thing that people really ignore, but that is
Mhm.
one thing which really, really helps in dental hygiene or
Yeah.
your own personal hygiene
Hmm.
when it comes to teeth.
So what happens generally, there are two kind of dental problems in the oral cavity that can happen.
Right.
First one is tooth related. We were talking about
Yeah.
cavities earlier. In tooth related, what happens is whenever a cavity is formed, it is slightly deeper.
Mm.
It gives a sharp shooting pain. It is
Yeah.
associated with pain or sharp shooting sensitivity.
Yeah.
Why that happens is because our tooth is a very special organ. What happens is it is a hard tissue,
Yeah.
but inside the hard tissue there is a soft tissue space.
Right.
What happens is when it is infected or the decay is deep, the soft tissue inside becomes hypervolumic.
Oh.
It, you can say, inflames. So it does not have any space to go out to. That is why it
Oh.
creates that much amount of pain. And due to the pain intensity that is there, the
Yeah.
person or the individual has to immediately visit the dentist and get it treated.
Correct.
The second thing, the first is tooth related, and the second thing or the second issue or problem that
Yeah.
people normally face is gum related.
Yeah.
Now, this one, gum related problems are most underrated or most neglected, I can say. that way.
Right.
Because what happens is with gum issues, there is no pain whatsoever.
Oh.
It is called as a silent killer.
Correct. I
Yeah.
don't think I've ever heard
Yes,
anyone
yes.
complain about anything
So
pain in their
what
gums.
happens is if say our hygiene is not that
Mhm.
great, poor maintenance, or some genetics are there, and a lot of plaque is accumulated,
Right.
which slowly forms into calculus. All these things, no, they lead to gum inflammation.
Right.
So once our gums get inflamed, the first sign that we see is they become originally they are pinkish in color.
Yeah.
They slowly turn towards reddish. They
Right.
look inflamed.
Right.
And after a few days or few months, this is a chronic thing. First of all, it
Yeah.
happens over time.
Over time.
Yes. So once they are inflamed, after a few days or few months, they start bleeding. When we
Right.
brush, why
Right.
it bleeds? If the gums are inflamed and our brush touches that part, it bleeds immediately
Right.
because it is inflamed. No?
Inflamed.
Apart from that, say if you are eating some hard substance like an apple with your front teeth
Yeah.
without cutting, then you will have blood marks on the apple where you
Correct.
eat from. So all those things are first early signs and symptoms of gum inflammation.
Right.
What happens is, unfortunately, in such situations, after the first, you can say 10-15 days of gum bleeding, it stops on its own.
Right.
The body tries to protect itself.
Protect itself.
So what happens is that particular individual feels कि अभी ठीक हो गया है,
ठीक है।
शायद से हमें दिखाने की जरूरत
Yeah.
नहीं है. And in those 15 days, somehow or the other, they have got other priorities.
Yeah.
अर्जेंट ऑफिस का काम रहेगा, दूसरा कोई फंक्शन
Yeah.
रहेगा, बर्थडे रहेगा.
Correct.
ये सब फैक्टर्स की वजह से नॉर्मली द पेशेंट डज नॉट विजिट द क्लिनिक
Correct. I
डायरेक्टली
think
फॉर दिस
we
पर्पस.
really put off
Yeah.
seeing dentists.
So
We
until
take
and
it
unless there
very
is no
lightly.
pain.
Yeah, when it's
Yes,
not very
you
obvious.
don't
हाँ
visit.
ठीक है,
Yes,
कैविटी
yes,
थी,
yes.
थोड़े दिन दुख रही थी, मैंने
हाँ,
कुछ
हाँ.
खाया नहीं, मीठा तो बंद हो गया था.
So what happens now is once the gum inflammation keeps on
Mhm.
progressing over
Yeah.
years, no, our gum recession starts
Right.
early to what it should start. Due to gum recession, there is bone loss.
Right.
Teeth start loosening. And
Oh.
all those things start. Mainly, if you want to look out for these symptoms, mainly focus on your lower front 4 to 6
Yeah.
teeth, because those are the teeth that will give up first, or you can say those are the teeth that will accumulate plaque and calculus first.
Right.
So they are a
So these are
very
the
good
signs
indicator.
people should
Exactly.
really look out
You can't
for.
look into the upper teeth into the mirror
Correct.
yourself, but you can always look into the lower front 6 teeth into the mirror
Right.
yourself every day, or at least once in a while,
Yeah.
to keep a check on them. If you feel
Right.
plaque is getting developed, then you can always visit a doctor and consult
Correct.
him at that time.
That's
It's that way.
right. So
Because
these are
later-
things we
yeah.
should actually
Yes,
look out
yes,
for
yes.
ourselves
And
because
the effects of this are irreversible.
right.
So once the teeth are loosened now, the gums have receded. Even if you
Correct.
go to the doctor can't do much.
Do much, yeah.
He cannot get the bone levels back. He
Right.
cannot splint them back. So
Right.
it is an irreversible change as well. Then
True.
we have to go for invasive procedures like removing of
Ah.
the teeth, replacing it
Correct.
with implants or bridges.
Right.
So as much as possible, if we can avoid all these things with routine regular brushing,
Right.
of course you have to brush twice a day. As you were asking what
Yeah.
basic hygiene you should maintain, you should brush twice a day. Apart from that, it is very important you brush in a vertical way, this way.
Right. And we
Many
are
a times
always
we tend to go for
every time
horizontal.
advertisements
Yes,
and
yes.
everything is going
Yeah,
this.
yeah, yeah.
So that's not
So when we brush in a horizontal way, it
Mhm.
does not clean the teeth
Clean the
completely because the food particles that get stuck in between
And
the teeth can only
right,
come
they
out in a
never-
vertical motion.
Correct.
Plus, in a horizontal way, the other problem is the other adverse effect is it can also damage your natural teeth. The outer layer enamel it gets eroded slowly due to hard
Right.
brushing.
Correct.
So you
So
have to always focus
overbrushing
on
is a
vertical.
thing, right?
Yes,
Yeah.
yes, you have to always brush in a vertical motion.
Right.
Brush twice a day, floss as much as possible, and rinse after
Right,
every
every
meal or at
meal.
least after sticky meals and all
Yes.
those things. To take care of.
So, yes, guys, they were not just joking in school. This is actually important.
Yes, yes. So
And
actually, all these habits are inculcated to us in our
in a
school days or
correct,
pre-school
correct.
days. But later on, as we grow up, we tend to
We
neglect
tend to neglect.
because we are late for our office or late for
Right.
our college.
Our
And
lifestyle
in our
changes
busy
with the
lifestyle, we tend
fast
to neglect these small
But I
things,
think it's
yes.
very important that we
Yes, yes.
still do make time for these things
Exactly.
because it is always better. Precaution is always better.
Yes, yes,
Because then even though the treatments are less invasive these days, I
No, no,
think
no.
it's we can
It is
those can still be
it is always
prevented.
better if we can prevent.
We can prevent.
And whatever minimal treatment or procedure required, it is always better and
Right.
preferred. Yes.
That's wonderful. I think yeah. So we have a few games for you, not just two games, very small games.
Okay.
So my first game is it is the most searched questions on the internet about your profession,
Okay.
which is dentistry,
Yeah.
and you very generic questions which
Okay,
people
okay.
go to the internet
Yeah.
for, funny of course,
Yeah.
and if you could answer them in just a brief way. Um, the very first question is, why become a dentist?
You are already laughing before asking me the question. No, the very simple
Yeah.
answer is it is a noble profession,
Of
as I
course.
had mentioned before.
Right.
Nothing better or more to say than this.
Yeah. And the second question, I think I must have Googled this a couple of times
Yeah.
as well, is should I use an electric toothbrush or a manual toothbrush?
No, always a electric toothbrush is
Electric
preferred.
toothbrush.
Of course, we should be with the times. If the technology and everything is improving,
Right.
of course, we should be accepting and using it.
Right.
But there is a special mention in individuals who have got deep fillings
Right.
or caps and prosthetic
Correct.
work being done, then they should prefer manual brushing
Right.
because what happens is with the electric brushing vibrations, it can tend to dislodge these prosthetic
Right.
crowns and fillings and all those
Correct.
things. So for them, manual brushing. Otherwise, electric brushing
Right.
is super.
I think a lot of people must Google this.
Yeah.
Is vaping bad for your teeth? Vaping, smoking.
Of course, it is bad for your teeth for 2 to 3
Yeah.
reasons. First of all, for your teeth aspect,
Right.
it has got chemicals like propylene glycol. What it does is it dries out your mouth and decreases the saliva production.
Right.
Basically, our saliva has got antibacterial qualities.
Right.
So if the saliva goes down, the teeth are more prone to cavities. And the
Correct.
chances of cavities are much higher as
Right.
compared to a normal individual. Apart from that, with vaping and smoking, there is heat generation in the oral cavity.
Right.
That is a very important thing. With heat generation, the blood flow is restricted.
Oh.
With the blood flow being restricted, there is gum inflammation, bone
Right.
loss, and long-term issues are there.
Right. So I think there is one more reason for people to quit smoking. Can I eat floss? This is a question on the internet.
You mean candy floss?
I think they meant that, but
Yeah.
I don't know.
So
If
of
it's
course, candy.
For our sake, I'm sure people should not be eating the dental floss.
So candy floss, of course, it is not the most healthiest thing that you can have. It is sticky and it is
Right.
almost sugar.
Correct.
So preferably you should avoid. But in case if you want to have it, I would recommend you rinse immediately after and
Right.
brush about 5-10 minutes later, so that it does not damage your teeth or gums
Right.
in any ways.
This is funny, guys. Why do I have to brush my teeth every day when my dog doesn't?
Maybe you can be like your dog
Yeah.
if you have the diet and lifestyle what the dog has.
Dog has.
So what happens
Interesting.
is animals, or you can say anyone, or previously what we used to eat was raw and unprocessed food.
Right.
So our teeth and gums used to get the exercise and the workout that they require to remain healthy.
Right.
Nowadays, with our changing lifestyle, the food has becoming softer and softer day by day,
Yeah.
and all those changes are happening. So the exercise or the workout that our teeth require is not there. So that is why they are becoming weaker.
Right.
As I mentioned earlier, the principle use or lose.
Correct.
If you are not using your teeth to the fullest,
Your body
then will slowly use them. It is that
course.
way.
That makes sense actually, guys. That were the top 5 most searched questions on the internet about dentistry. I will move on to the next game, which
Okay.
is so I'll tell you, it is guess if it's a real profession or not. So I will list a few the names of professions, and you have to guess if those are real or fake.
Okay.
So there are some weird names in here. So I myself was surprised to find out how many of them are real. But yeah, the first one is dog food taster.
I think I have a feeling this should be true.
True?
This should be right, yeah.
It actually is true.
Yeah?
So
Great.
they do taste. Humans,
Yeah,
guys. Humans taste dog food. And that is a real
It is
profession.
weird, but yeah.
It is
if it
weird,
is there.
yes. And second is professional cuddler. Cuddler.
I think this should be false.
It is true.
It's true.
Yeah, there is a professional cuddler. This is people pay for just having a
They
professional
should be having a
cuddler.
course to learn this thing as well. Then.
I think that should be our next episode as well.
Yeah,
If we could
should
find
find
one,
out someone.
please in comments, anyone. Sandwich architect.
Doesn't sound like to be true. It should be false only.
It is.
Yeah.
It's fake. But it would be really great to have someone really make your sandwich to the perfect
The
crisp
chefs are
of it.
sandwich architects only that way.
Oh yeah. True.
Yeah.
The other profession is a space lawyer.
I think it should be true. The last two ones were false. I think it should be true now.
Yeah, it's true, guys.
Sure.
There are lawyers who work with whatever it comes to space. I still don't know the gist of it, but they are a profession. An emoji translator.
I think it should be false. But even if it is there, it is a good thing.
Yeah, because it is actually false,
It is
yes.
false.
But yeah, I think there are a lot of emojis coming up, especially with Gen Zs using so many different emojis.
Sometimes it is difficult to understand what the person wants to say exactly.
Do you get any text messages from your patients or something, any very young Gen Z patients, and like you just don't understand? They are just using these slangs, how you know the way Gen Z talks.
It is there slightly with emojis and slang, but Google is always there.
True.
So you can find it out quickly. I don't think so profession might be required for that.
Yeah, true. It's fake. The last one is hangover engineer.
I think most of the close friends are hangover engineers. It should be fake. Yeah.
It's fake. It's not a true profession. And that was all from my side. Thank you very much, Abhirav. It was very great talking to you. And that would be all. I hope you enjoyed.
Yes, it was a great experience having a conversation with you. And all the other small things that were discussed about basic dental hygiene and all the other things.
Yes, this was a very insightful conversation. I think I'm taking so much home with me. Even after being to dentist for so long, even in my teens, I think I've still learned so much more.
It's an important thing. If you can take on something and take it with you, then you have actually learned, or you can say,
true.
new exposure
I totally have.
There,
I totally have. That was all. Thank you so much, Abhirav.
Thank you. Yeah.